Hi, my name is Dr. Jyoti Rao, and I'm the Medical Director of Shakthi Health and Wellness Center, and I wanted to talk today about what it feels like to be a part of our practice and what does the first consultation look like. We meet after you've filled out a questionnaire about your standard forms, which are related to your family history, your surgical history, medications, illnesses, hospitalizations. We meet for about an hour the first time to understand what has been done in the past and what still needs to be looked at. For example, if someone's coming in with fatigue, we look a lot at the previous history where you first started to feel fatigue, from going back to childhood illnesses, going back to family and how you were raised, the genetics, if there was any toxins, work experience, current stress levels, all of which play a role in terms of deciding what tests would be ordered at the first visit, whether those tests are just labs from LabCorp or Quest, like a traditional doctor would do, but maybe we would add more to look for things like occult infections, Lyme, mycoplasma. These are infections that can kind of harbor low grade in the background that can also give people a sense of fatigue. Is it a hormone imbalance? We can do salivary tests or urine tests for that as well. We can look at nutrients to see if your mitochondria is supported. These are the energy producing cells of your body. We can look at stool to see what your gut microbiome, which is essentially very integral to our overall health. We can also look at food sensitivities if it's deemed appropriate. So the testing and which tests we're going to order is going to be discussed also after a thorough history and physical at the first appointment. After that, you'll spend some time with my staff members, either Kelly or Emma, to go over how to do the test, what does it entail, how do we collect the specimens, and what kind of information the collections of the kits or the people, the companies that are need the information for you to get the testing done. 4 weeks after that consult, we meet again to review a plan. We make some general suggestions after the first appointment, but mostly the final plan is after the second appointment, because we're going to use your personalized information and data from your testing to kind of make a full plan for how we're going to deal with the root cause of the illness.